Hi class, it's Dr. Balderas. Well, we are almost done with modalities. We're on our final leg of this. We'll be talking about spinal traction the next 2 weeks, and then I think we have biofeedback, and then we are done. So this is chapter 18 in Cameron. You can see that this has been going on for a really long time from the photograph here. James Siriax is one of the beginning influential people that started using traction back in the 40s and 50s for people with disc issues and radicular symptoms and finding success with it. And over time, we've just done more research and found parameters and dosages that we find effective for patients. You guys can also listen to Lindsay and Paulo's video presentation on recent evidence-based research. They did a nice job pulling out a couple articles that showed the effectiveness and also articles that really haven't shown yet the parameters of the dosage. So we just utilize clinically what we've seen has worked effectively for us. So you'll get a little bit of all of that in this lecture and also in lab. Me personally, in the clinics that I have worked in the last 10 years, it's pretty much been manual traction or a home unit, a Saunders unit for the lumbar spine or the cervical spine. When I fill in at a few clinics, I get to use mechanical traction, which is very effective for those discal patients. You'll get to pick both Dr. Smith's and Professor Eckert's brains a little bit because they use it quite a bit at Kaiser, and it's very effective on certain patient populations, so you'll be able to ask them the parameters and how they use that. But we'll also follow the book as far as just what's out there right now currently. Okay, and so in this first section, I'm going to just try and keep these to 5 to 10 minutes for you, so we'll kind of break them up like we did with the last ones. Okay, so here we go. So the learning objectives for this topic will be several. So basically we want to understand the different traction setups, the protocols, minimum, maximum poundage, and the rationale behind each of those. We want to identify what to assess with traction treatment, the adverse reactions, the normal reactions, and the beneficial reactions. We want to be able to comprehend what rebound effect is and why it occurs and how we can prevent that. We want to be able to identify and demonstrate the safety checks before administering traction to a patient. We also want to describe the advantages, the disadvantages of both mechanical and manual traction, and also for self-positional traction as well. We want to understand when you need to stop treatment and why. You want to be able to describe and demonstrate what positions for what level of the spine you are treating. For example, when we put the cervical spine into more flexion, we're treating the lower cervical spine. When we put it into more neutral position, that's going to get more the upper cervical spine. When we do this with the lumbar spine, if we increase into more flexion, so like that position with their knees up and into 90 degrees, that's going to get more the lower thoracic and the upper lumbar spine. When we put them more into neutral or that prone position, that's going to get the more lower lumbar spine. You also want to identify the contraindications, the indications, and the effects of traction. You'll also want to be able to comprehend and describe appropriate treatments for different patient scenarios. Again, we'll have a chart where you're going to fill out the different parameters, be able to know the physiological responses, what pain pathways are being facilitated in theory. So those will all be your learning objectives for this course. Okay, so I think that's good for right there.